Hundreds of thousands of NHS workers have just launched a blistering campaign against Prime Minister Starmer's rumoured 20% cut to the Global Fund. What's the Global Fund? Only the world's largest partnership fighting HIV, tuberculosis, and malaria. These healthcare heroes aren't mincing words. They're warning that slashing this funding puts Britain itself at greater risk from infectious diseases. Let's be crystal clear about what's happening here. Britain has historically been a leading contributor to global health initiatives. But now, sources say Downing Street is considering gutting support by a fifth. Think about this. In an era where we've seen how quickly diseases can spread globally, are we really considering pulling back our defences? The NHS workers' letter puts it bluntly. These cuts wouldn't just harm vulnerable populations abroad, they'd increase our own vulnerability. What's Starmer thinking? The government faces brutal economic headwinds, sure, but is cutting disease prevention really where savings should come from? Consider this: for every pound spent on global health security, experts estimate we save multiples in future healthcare costs and economic disruption. Is this short-term thinking or calculated political maneuvering? What do you think is driving this decision? Workers as political force. This isn't just any protest. The NHS represents Britain's largest workforce, and they've become increasingly politically active. Remember how they mobilised during the pandemic? This coordinated action shows they're wielding their collective power on global issues too. Could this become Starmer's first major confrontation with healthcare workers since taking office? Britain's potential retreat from global health leadership comes at a critical moment. Other nations are watching closely. If the UK steps back, will others follow? This could trigger a devastating domino effect in global health funding precisely when infectious disease threats are rising worldwide. The timing couldn't be worse.